So there are 4 ways to treat patients. So the first one is not to do anything, but then that really doesn't help long term, because you will have bone loss where you're missing a tooth. The top teeth might supraerupt or the bottom teeth might go up. So that's not usually recommended. The second option is to replace it with partials, but they are not very comfortable. Patients have to take it off at night. It's good for aesthetic reasons when you're missing a tooth, but it's not really a good replacement option. The third option is to replace missing teeth with bridge. That was the norm in the past. A missing tooth would be replaced with a bridge, but then when you're replacing a teeth with a bridge, you're also kind of shaving off the adjacent teeth. Otherwise wouldn't need any treatment, but now you're like, to replace one teeth, you're damaging the 2 adjacent teeth. If anything happens to one of the tooth of the bridge, then you end up losing 3 teeth or 3 crowns. But again, in some cases, we recommend doing bridges. And the fourth option is to replace a tooth with an implant. So if you are missing a single tooth, a single implant is placed in. Implant is essentially a screw that goes into your bone and replaces the root portion of the tooth. It does take some time. So you will have some visits to the dentist, because the implant takes some time to heal. It's a good investment for a long-term benefits, because it helps you restore your smile and your chewing performance and not damage your adjacent teeth. And it also restores the level of the bone. So when you replace a missing tooth with implant, that bone is stabilized, and it helps maintain your oral hygiene too, because you can actually floss between implants versus bridge, which is very hard to floss, and you have to use a floss threader to make sure that you're flossing well. With implants, it's a long-term investment, so it'll always help you maintain your smile and keep your teeth healthy.